On September 13, we're going to get new freedoms in. These, people will be picnicking, but there's still been no talk about benefits for double vaccinated people to visit elderly in aged care facilities. When are you going to make a decision about when people in aged care facilities can receive visitors again?
Look, as soon as health says it's okay, of course we'll do that. So we're just taking our advice, and I suspect it has to do with making sure there's evidence of full vaccination and also vaccination of workers, so all those issues, and health will give us that advice. I mean, we want to see, our whole aim during this has been to reunite people that haven't been able to see. I haven't seen my parents for more than 2 months. I'm sure many of you haven't seen your loved ones either. And this is a very difficult time, and we want to make sure that we provide those freedoms as soon as we can. But I know that people will not believe me when I say this, but we have done incredibly well to keep the case numbers where they are, given our population, given the spread. In fact, if you look at the trajectory of where Victoria's case numbers are going, I'll let people make those comparisons themselves. But having been through this, we know how quickly case numbers get up to where we are now. And had we not taken the measures we had, they would have been much higher. But at this time, when we don't have the vaccination rates where they need to be, because 70% and 80% are the safest, we don't want people risking heartbreak. We don't want people ending up in ICU or dying. And we want everyone to be protected. So we're going through that process now. I always said September and October would be the most difficult months, and they will be, but also the best months in terms of the future.
Premier, can I just ask you?
Premier, am I able to ask you a non-COVID related question? Well, when you're at the end though, can I just
ask the Premier one, please? Premier, can I just ask
This is about COVID, I'm sorry.
Okay, Premier, can I just ask you?
Sarah.
New South Wales actively considering releasing up to 1,000 prisoners to reduce overcrowding with some health risk?
I'll ask Dr. Gale to talk about the prison system, if that's okay.
And also, Dr. Gale, what are you doing to reduce the spread to regional prisons if you can?
Sure. So I can't speak on behalf of corrections, but what I can say is that from a health perspective, clearly we are concerned about prisons as a setting for spread. We know that often we have vulnerable populations who are in prisons. We know the conditions in prisons often are conducive to the spread of communicable diseases generally. And there has been a lot of work done in the sector since the beginning of the pandemic to have plans to reduce the risk. And I know that Justice Health in particular has done a lot of work in planning to try and make our prisons as safe as they can be. There's been a lot of efforts in rolling out vaccination as well to prisons, both for staff and for people detained in prisons. Clearly at the moment we're concerned primarily around cases in the Parklea Correctional Centre. We now have a total of 80 cases in Parklea, and there were 5 new cases reported overnight. There are a total of 77 of those are inmates and 3 are staff members, and I think it's an example of the risk in our prison system, but there's a lot of work being done at the moment in Parklea to make sure that the infection control practices are robust, that staff have appropriate PPE, that vaccination is being rolled out with intensity. There was already pretty good vaccination coverage amongst staff and in Parklea. So there's a lot of effort going into that, but I think it does demonstrate the risk in the prison system and a lot of focus there across the state about managing and mitigating those risks.
Does that include releasing prisoners though? Is that on the cards?
I can't speak to that from a health perspective, but certainly from in terms of reducing public health risk, the fewer people and the less overcrowding in the prison system is certainly useful in reducing the risk of transmission.
Just to follow up on that, have we seen the Parklea outbreak spread to other prisons, specifically Bathurst?
No, so we haven't seen spread from Parklea to elsewhere. We know that there have been people released from Parkley and they are being closely followed up and tested to make sure that there's no risk to anyone else in the community from people who might have spent time in Parkley. In terms of Bathurst, we are aware separately of cases in the Bathurst Correctional Centre. There are 9 cases, all in staff members in Bathurst. So at a smaller scale to Parkley, but nonetheless concerning. And again, a lot of effort going in locally to make sure that staff and inmates in the Bathurst Correctional Centre are being tested, that infection control processes are in place and that vaccination coverage is high.
Dr. Gale, we...